Hello friends, welcome back to my YouTube channel. Today's video is on audience demand. There is one video of mine on ways to make the penis longer and thicker. In it I told about P-shot and penuma. Since then lakhs of patients have been coming, calling and getting treatment. But everyone has the same doubt that what are the options available to grow the penis longer and thicker? Please explain the methods. So in today's video I will tell you the options that are available if you want to increase the size of your penis. We will explain the details of the options in the upcoming video, but today's video is about the current options to increase penis size according to scientific knowledge. And what is the net cost of those options, and how much profit is there in the options, what are the losses, and which option can we try in a particular patient. The video will be a little long, it might be a little boring as well. But if you are applying oil on the penis to increase penis size, so nothing is going to happen with that. Okay. If you want to increase penis size, then you will have to get some treatment for it, and this video is about the treatment. We'll provide you full information. Friends, this is Dr. Vijayant, Govinda Gupta, an andrologist in New Delhi, India, which means a male specialist surgeon. Be it penis size, erection, early discharge, not being able to have children, inability to urinate in the penis, prostate problems, or related to the testicles, I am a surgeon and I have their treatment that ranges from medicine to surgical treatment in the field of andrology. But at the same time, I always try to ensure that if the patient recovers naturally, which is why I also try to give you natural tips and tricks on my channel so that you do not need surgery or medicines. So let's start today's topic. The first thing is that no man is satisfied with the size of the penis. If someone's penis is 7 inches, he is also worried. If someone has 3, then he is also worried. End of the day, what is normal penis size? Normally, what size of the penis is needed to satisfy your wife? I have a separate video on it. Link is given below, please watch it. Today the topic is how to increase the size of penis. The first question that comes is whether the size of the penis can be increased. Yes, it can be increased. Can the size of the penis be increased safely? Yes, if you get the surgery from a good facility, it can be increased safely. But should we undergo surgery to increase penis size? No, to increase penis size first, you should try non-surgical or non-invasive methods. If you are not feeling better with non-surgical, non-invasive method, and you are not getting any improvement, then you should go for surgery. Then the question arises whether there is any way to increase penis size non-surgically. There are 2 types of non-surgical methods to increase the penis size. The first is medication. Medication means hormones. Hormonal injections like growth hormone, testosterone, HCG, FSH. We have many types of hormones and hormonal medications. Patients in whom, due to hormonal disturbances or due to age, the size of the penis is not getting developed fully as per the requirement. Young boys who are 18, 19, 20, 21 years old. Normally the body has the potential to grow the penis for 25 to 26 years. In many children, due to hormonal disturbance, the growth of penis stops after 17, 18 years. The penis does not reach its proper growth. In those patients, we can treat them with hormone treatment and can bring growth in penis. There are some young boys in whom penis growth is fine. A little bit of increase in the size is needed just by half to 1 inch. Then sometimes the hormonal medication can be very beneficial. But be careful. Hormonal medications and testosterone have their side effects also. Growth hormone also has its own side effects. Height loss, weight gain, pimples, acne, stress on testicles, reduction in sperm count. Only a qualified doctor can normally do the assessment and start the hormones for you. Many times we treat these hormones non-interventionally, like we add it into P-shot or vacuum pumping that is applied to the patient, and it gives good results in penis growth. Are there any medicines or supplements that can increase the size of the penis? Categorically, any oil, be it Hammer of Thor or any oil, no oil will give the increase in size no matter how many times you massage the penis. Yes, if your penis is in contraction or retraction, can't get erection, blood supply is not complete, and there is a shrinkage. In that case, pineal massage can help you a lot, but for it no specific oil is provided. If you massage penis using any good moisturizer, you can get very good results. Then we come to the injections. There is an injection P-shot or PRP. A good increase in penis size can be achieved through P-shot or PRP. In men, you can get the 15 to 20% of growth in penile length and penile girth. It is available in both flaccid and erect state. But P-shot is not a magic injection. If your penis is already of a fine length and girth, then no matter how much injection you get, the size will not increase. Yes, if the size is less at first, then you will get a good benefit from it. P-shot brings erection in penis, enlarges penis, increases girth, increases hardness. But this is a slow process. You might hope for it to be done in 3 or 4 days. For P-shot or PRP therapy, you will have to visit us 4 to 5 times in a year. It is injected every 2 or 3 months. Injections are accompanied by penile traction therapy. P-shot or PRP may give you a 20% difference in the length, girth, and hardness of the penis. But with this, you may need penile traction therapy or andropenis, an FDA-approved product which corrects the length of the penis. This will have to be used. Many times the question arises that we are increasing the length by penile traction. How will it increase the girth? It's not like that. When the penis gets growth stimulus, then girth also increases along with the length. Yes, in some schedules, a vacuum pump is also used along with P-shot, but I do not usually prefer vacuum pump. Many times because of vacuum pump, the penis might undergo venogenic ED, the penis becomes longer but does not become erect. Even then, it is of no use. Secondly, P-shot is made in many ways. Activated, inactivated, leukocyte-rich, leukocyte-poor, 1 spin, 2 spin. Along with it, there are many additives like calcium activation or VGF. So which P-shot will be good for you? That depends on how much experience does the surgeon doctor have with his patients. Does P-shot work for all patients? No, P-shot doesn't always work. If the patient is diabetic, he used to take steroids. Penis is not healthy, ED is there, veins are damaged, then many times the P-shot will not work. So the P-shot injection does not work for everyone, but the patient in which it works, it does wonders. At my center, for an instance, we do PRP therapy in 500 to 1,000 patients in a year, and many patients get very good benefits. So these were the non-invasive methods. Non-invasive method means if there is not much difference in the patients, and they only need 0.5 to 1 inch in length and girth, don't want to get a surgery, want the natural healing. This treatment is quite beneficial for them. Now coming to surgeries. We have 2 types of surgeries. One surgery is done to increase the length of the penis. Other is done to increase the girth of the penis. The girth of the penis has 2 parts. There is one to increase the girth of the glands of the penis. The other one is to increase the girth of the shaft or the corpora of the penis. For increase in length, we take out the penis from inside the body. The surgery to increase length is called VY-plasty with ligament release. Normally, you might have seen my old video. You must watch this video. I explained in it anatomically that as much penis is outside the body, same amount is there inside the body. There is a ligament that holds the penis in the middle. If we cut the ligament, then by cutting the ligament, we can get 1/3 penis outside the body. Suppose someone's penis is 3.5 inches. By cutting the ligament, we can get 1 to 1.5 inches and sometimes even 2 inches in length. But cutting this ligament has advantages and disadvantages. The advantage is that the size increases, length goes out. The disadvantage is that the entire veins of the penis passes near that ligament. If the nerve gets damaged during the cutting of that ligament, then there could be a difference in erection. Second, sometimes if the ligament is completely cut, the penis hangs. During an erection, the penis does not go completely upwards. Sometimes if the ligament is not cut properly, then the penis may get pulled back into the body. So even after ligament cutting, regular traction is essential. Ligament cutting cannot be done by everybody. Those who can do it regularly and properly do so. Many times, even after releasing the ligament, patients suffer losses instead of benefits. Along with ligament release, inversion and VY-plasty of the overlying skin and tissues is necessary so that whatever length gain is done in the patient stays there for a long time. So we have ligament release for the length increase. Again, we have 2 types of treatments to increase girth. One treatment is injectable, in which we inject something under the skin of the penis so that the penis expands. We have hyaluronic acid in these injections, which are very expensive and sometimes does temporary work. Sometimes it doesn't even work. It comes in Korean and European variants. European is better but expensive. Korean is cheap but doesn't work for long periods. The effect of hyaluronic acid is temporary. In some people, it stays for 6 months, and in some people for a year, in some for 2 years. A great patient has come to me whose condition has lasted for 5 years, but that is completely luck. Most commonly, the effect goes away within a year. Apart from hyaluronic acid, there is also a HA, which is called PMMA. The effect of PMMA lasts for many years, but PMMA is a slightly toxic injection. Applying several large injections can cause the penis to darken. The penis may also be damaged. I have used PMMA in my patients. The result is also good, but PMMA is not easily available. If you get it, then it could not be applied. If it is applied, the results might not be as good. Third, we have is fat. Whatever fat is there, you can take it from the chest, stomach, or backside. We take the fat out and spin it, and it is called lipolyzed fat autograft injections. Means whatever fat you have, the fat is removed, spun, all the bad stuff is taken out, and the good, healthy fat is injected into 5 or 6 points in the penis, which causes a lot of swelling in the penis, and a good girth comes. This treatment is also good, but there are 3 things that you need to understand in this. The first is the amount of girth you will gain the day after surgery. After 6 months, 1/3 will be left as some fat is absorbed by the body. Secondly, if the fat injection is done wrong, it can enter the blood and cause heart attack or chest attack. It is important to be very careful. The third is that it is not necessary that the fat stays where it was injected. Many times the fat that was injected gets spread. Many times patients come that the fat that was injected in the penis, but after 6 months, the fat has moved behind the testes or moved up in belly, and the penis size doesn't increase. But if done properly, this 1/3 fat that remains in the penis can also give satisfactory experience. One more point. It is necessary to get a good erection to get the good girth. If the erection is weak and you want to get more girth, then it will be same as some person is about to die and you put a load on him. Where penis is not getting erection, on top of that you add girth, then there will not be any erection. Patient gets a lot of pain. Patients who also have erectile dysfunction should try either to get the P-shot or to get the implant inserted and get a surgery, because girth increase is a bit difficult with erectile dysfunction. This was about injections. Some patients say that we need permanent girth increase. If you want, then we have 2 options for permanent girth increase. One is silicone implant, which is called Penile implant, and one is dermal fat graft. So Penile implant is basically made in USA. Dr. John Ellis is a great surgeon. It was invented in America. It is available in America only. This implant is not available in India. But I have invented Indian Penile implant for my patients, for my implant patients, in which we place a mesh over the layer of silicone. With this, we can increase the penis girth by 1 to 1.5 inches. The Penile implant makes the penis look more beautiful than it is. If the implant remains in its place, then it gets good thickness, and the patients remain very happy with it. Penile implants can also increase length, but Penile implant also has its own side effects. Infection may occur. Sometimes the body does not accept implants and may get rejected. Sometimes the implant can stick to the skin, and sometimes the implant can also shorten the penis. So if there is a surgeon who is asking for a Penile implant, you should definitely check that if he understands Penile implant, or just copying my videos and telling you. It happens nowadays. I made a video today. 4 people will copy it tomorrow and tell you they don't know how to do it and will ruin the patient. Get properly consulted and get the proper treatment. And then comes the dermal fat graft. Dermal fat graft means like there is some body part. In our part, it could be stomach or thighs or backside. Where there is a lot of fat, if we take that layer of fat and wrap that layer of fat around the penis, so we get a pretty good thickness. Dermal fat graft is the next level or next step currently to increase penile girth, and it also gives great results. Surgical girth, increase whether it's penile, whether it's dermal fat graft. I prefer to do it after penile implant. Why? Because we have put an implant in the penis. Penis is already very hard and very strong. There's a lot of life in the penis too. And on top of that, penis is wearing a robotic suit just like Iron Man and is ready to fire up. So it will support as much girth as you put on it. So be it dermal fat grafts or Penile implants. Normal penis cannot bear so much of weight in erection. Normally it works in boys who are still young and get a good strong erections. So in simple words, I have described the textbook on penis length and girth, which is of 7 volumes. I have described it in 8 to 10 minutes and included all important points. It is not as simple as it looks. Many a times there might be a damage in the penis in the process of length and girth increase. So always stay careful. Always try non-invasive therapies first. Get a P-shot or penile traction first. If it doesn't work, then you should go for the surgery. Always choose the surgery from a good center where you know that you will not be cheated. Thanks for watching the video. If you understood it, then share it with friends, and please subscribe.